Yeah, so it's a really good question. It's something I'm quite passionate about. So we see a lot of pediatrics, like I was saying, at Ezekiel Eyes. I think the big reason to bring kids in, even if they're not complaining to you, is because a lot of the time what I find in practice is children might have these vision problems or these vision issues, but they might not actually recognize that they have them. They might assume the way that they see is normal, even if when we put them on the chart, it's not so normal. The other thing that I find is a lot of the time kids don't really have the vocabulary or the words to explain the issues that they actually might be experiencing. So concepts such as blur or concepts such as eye strain or double vision, it's really, really difficult for a child to actually explain that to a parent. So I think the big thing is just because they're not complaining, I wouldn't assume that nothing's wrong. I think it's better to get it checked out even if they aren't complaining. The other reason I would say, and what happens a lot in clinic and I see a lot, is what tends to happen is if one eye has poor vision or one eye is having issues, the brain's quite amazing at compensating for this with the good eye. So a lot of the time, it's not until the child sits in the test chair and we test each of the eyes individually that a problem's actually revealed, just because the good eye's been compensating the whole time. The other reason I would say is an eye exam these days, it's a lot more than testing vision. So a lot of parents think that just because their child can see the board or they can see signs okay, that there's no issues. But modern eye exams these days test a lot more than clarity. So when kids come into our chair at Ezekiel Eyes, of course we test the clarity, but we also test how the eyes work in isolation. We test how the eyes are coordinating together. We test how the eyes are focusing. We test whether the eyes are aligned or not. So there's a lot more that goes into an eye exam these days than just checking for clarity. The other thing, and I really could go on all day about this, Paul, but I'll keep it as short as I can, is it just gives us a good baseline. So the first time we see a child, we can take the measurements that we need, we can take objective measurements. We then have a baseline that we can compare over time. So we basically have data that we can use to compare how the child's eyes or vision are changing, and we can compare to themselves, which is helpful. So there's so many reasons. It's very important.
Well, short-sightedness or myopia is something that, we hear more and more about these days, and maybe changing lifestyles is part of that. So, what is myopia management, and
Mm.
what does it involve for patients when they come to your clinic there at Ezekiel Eyes?
Yes, it's a great question. I think before I go into it, I'll just explain what myopia means. So I would imagine a lot of the audience has probably heard it described as short-sightedness, which is the term that most parents will be more familiar with. And basically, what short-sightedness is generally you can see up close, okay, but things in the distance tend to be quite blurry. So the most common complaint will be the board at school looks blurry. The reason for this is because the eye is slightly longer than what it should be. So you have a longer eye, basically it affects the way that the light focuses and it causes blur. Now, myopia management, basically the overall goal of myopia management is to stop this eye getting longer and to stop the number or the prescription going up. Now, traditionally, the way we managed myopia was we just gave the child or the adult glasses. And the glasses provided them amazing vision, but it did absolutely nothing to slow down this eyeball growth. It's a little bit different now in that the approach we take is we still have all these options that correct vision and sort of get rid of this blur, but it also slows down the stimulus that's making the eye want to grow longer. So we're treating it whilst giving good vision. The way we do this, again, this could be a conversation I could go in all day about, but there's so many different myopia control strategies. Just to go into them very briefly, the first one we typically go with is the spectacle lenses. So basically, they're specially designed lenses. You wear them like any other glasses, you get great clear vision, but they have a special technology in the side that acts as a signal to slow down the eyeball growth. Can put the exact same thing as a contact lens, and then the kids wear these. It's a daily disposable. They wear them, toss them at the end of the day. The other thing, there's another special type of contact lens, which we fit a lot of in practice called Ortho K. Some parents might have heard it be referred to as night lenses. Basically, you sleep in the lenses, they reshape the front of your eye, you wake up with nice, clear vision, and it will also slow down the growth of the eyeball. The other thing is there's also eye drops. So a lot of the time, parents can also use eye drops, and basically you put the eye drops into the eye before the child goes to bed, and then they also slow down the growth of the eye. So as far as what myopia management involves, it starts as a conversation to find out about a child. What are their needs? What's their prescription looking like? How are things changing? What are their risk factors? And then we tailor the solution to find the closest thing and the most appropriate option for the child. But the big thing now is we're actually doing things to slow down the growth, which will reduce the chance of having any issues into the future. The big thing I would say is a lot of these control strategies, because the child's still growing, everything in their body's growing, we can't stop the eyeball from getting longer. But a lot of these will be very, very effective at slowing the eyeball growth down. And they're very, very effective strategies. The outcomes we get in clinic are amazing. So it's a lot more involved these days. And technology is constantly evolving. It's a really exciting space to be in, actually.